Hey everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Today, I am super excited to introduce you to my friend, Cheryl Flowers. Cheryl, thank you so much for being with me. I'm so excited to have you on the podcast. I'm so excited to get to talk to you again.
I'm super excited to be here, and I just want to thank you so much for the opportunity.
Oh, awesome. I can't wait to share your story with everybody.
Yeah.
So let's take this back a little bit. Professionally, you and I have known one another for like almost 10 years, I think.
Yeah, it's been about that.
Yeah.
Yes.
Yeah. And so we have so many areas we can cover, but you and I met because of, I believe I was speaking at a trauma conference you were attending.
Yes.
And you are a nurse, and not just a nurse, but you have experience in emergency and surgical nursing and education. You've got a lot of stripes after your name.
Yeah, a lot of studying going on in this house.
a lot of study. So I am excited to get to share all of your professional expertise and your personal experience too. But before we get started, I got to know, how's your puppy dog doing?
Oh man, Coda Bug. It's the amazing Coda. Yeah, she's doing wonderful. She just turned 1 year old, and she is just a ball of fire. She's wonderful. Wonderful.
I am so excited to hear that. And she's a German Shepherd?
She's a German Shepherd and a white Swiss Shepherd. Marcus, I had a DNA test done on her. She's amazing. She's amazing. I got her from a Alabama kill shelter and a rescue place here right here in Newark, Delaware. Helped bring her up from Alabama and saved her along with 8 other puppies. And I was lucky enough, she picked me to be her mama. So it has been a journey for us this whole year. She's wonderful.
You know, and it goes right along with what we talk about on this podcast, which is compassion. You know, the compassion of a dog, the presence of a dog, the non-judgmentalness of a dog.
Yes.
It's just such a reflection of how we should be in our, I guess, in all of our lives. What
Absolutely.
We should strive for.
Absolutely.
Yeah. What do they say? It's like, let me come back, let me be half of the person that my dog thinks I am.
Wow. Yeah. Hey, if I could be that person, oh man, I'd be president of the United States, I guess, or anything I'd want to be.
Well, I know you are right where you need to be. So let's tell your story a little bit. Tell me, like, you grew up in Delaware.
Yeah. And
did you always want to be a nurse?
I wanted to be a nurse my entire life. I mean, this is the corny part of the story, Marcus. All right. So my whole life, I never thought about being anything else. I was the little girl with a little nursing bag. I had some brown Vaseline. I had a little jar of Tic Tacs. Those were my medication. I had Band-Aids, and I could fix anything with this nursing bag. And I just wanted to care for people. And, and it went on from there. And I knew that this was my true calling to be a nurse. I wanted to care for people, and I went on that journey. I graduated from BB School Nursing in Lewis, Delaware, and really, they told us not to have tunnel vision, but I wanted to be an ER nurse so bad. And, back then you could not go into a specialty. You had to kind of earn your way, do some med surg first, and then go out into a specialty like the emergency department. But that ER was really calling to me. And so I put my application in, and luckily I was accepted 6 months prior to me even graduating from nursing school, and started my journey in the ER. And loved every moment of it, and just wanted more while I was in that ER as far as education was concerned. So I went back to school, went back to the University of Delaware and received my bachelor's degree. And but still, Marcus, I felt like I could give back more. And so I wanted to become a clinical educator, but I wanted to have that education base and foundation. And so I went back to school, and I wanted to go back to school, and I wanted to apply for a master's program, and I had gathered all the information. In the meanwhile, I was transitioning into my new job as a clinical educator, and I had to make the decision to either stay in the emergency department or go more the management leadership route. And so I had to make that decision, which is hard for people to do change, and leave the ER and go and be in clinical education. And so I left the ER, started my job. 4 weeks into my job, I was out with another nurse, and we were going to go to a senior center, and we were waiting for one of our speakers to come do a talk on safety to the seniors, and they were gathering out in the hallway. And I remember I went to the bathroom, I was coming back, and our laptop broke. So the nurse that was with me, orienting me, she was on the phone with IT. I talked to the man outside in the hallway. I said, we're having a little technical difficulty. We'll be right with you. And I said, well, I'll sit right next to this window and check my work email. And so I'm checking my work email, Marcus, and all of a sudden I hear this horrible car crash outside. And so all the years of me being an ER nurse, I jumped up and looked out that window to see if I could help. It was instinct. I did that. What happened, there was a gentleman that was going, he went through a red light. He T-boned this young lady that was in a car. That was the crash I heard. When I split those blinds to kind of find out what happened, he lost control, came through the building and hit me head on. And that's how my journey started and how I got to you.
Yeah, I find myself getting tense because I've known your story. It was how many years ago now?
So I'm at year number 9 right now.
You're at year number 9. So I met you real soon after your trauma.
Right.
So, okay, like I said, I find myself tensing because I know the trauma, but I guess we need to go to chapter 2.
Correct. So chapter 2 is hard, Marcus. Hey, woke up in a helicopter, and I heard a medic saying brace for landing, and I'm trying to tell them there's an accident that happened outside, and not even realizing you've already been through a trauma code already. You were the trauma code. You've already been helivaced. You're on your way to a level 1 trauma center. You're sick. And so I remember, and it was like, Marcus, it was like flashes. Like I would have a memory and then I would go away. And then I would wake up and have a memory and then I go away. And the next thing I remember is ceiling tiles. I was seeing lights and ceiling tiles as I was going down the hallway, headed into the trauma room. And I remember a nurse saying, she was taking my straps off. And I remember her taking my straps off so hard, it seemed like. And she was saying, Mrs. Flowers, you need to talk to us. Let us know what's going on. What's your name? And I remember looking at her, and I remember inside I was saying, I don't know what you're talking about. There was this accident outside, but then she said, can you talk to us? And that's when I got scared, because I was like, in my head, I was like, I don't know how. And so another nurse came up and said, I see you really struggling. And I don't remember much about that day, but I remember distinctly these moments. The nurse said, you're really struggling. Here's a piece of paper and a pencil. I want you to write down what you want to say. And I remember grabbing that pencil and looking at that paper and not knowing what it was. And that's when I got scared and realized that I didn't know how to talk and I didn't know how to communicate about this still worried about this accident, and what's going on kind of thing. It was
Were
scary.
you in pain at this moment?
I was scared at this moment.
Scared?
Yeah,
Okay.
I was
Yeah,
like,
of course.
I was confused. I didn't understand. Marcus, the best way I can explain it, and I have, I don't share this story. I use special moments to share this part, but I felt stuck inside myself. Like I felt like I wanted to say something, but I didn't know how to speak. I didn't know, and my ears were ringing. It was too bright in the room. Scary moment. Scary moment.
Yeah. Wow. So the pad and pencil and not knowing what to do with
Yeah.
it. That's a moment. That's a
Yeah,
moment.
that's when I knew, hey, something's wrong with you. You need help. But how do you tell people that you need help? How do you tell them what's going on? And so I had to rely on the nurses and the healthcare workers around me in that trauma room to help me. But communication from me to them and telling them where I hurt and what's going on, that was not going to happen because I didn't even understand. I didn't understand anything. And I barely understood what they were talking about. And here I was, a trauma nurse. And I don't know how to speak or tell them what's going on. Scary moment. Reality check.
Yeah. Wow. So you know my story, and Jennifer being there
Absolutely.
in the ER for me. Did you have anyone who was there for you in that scariest of moments?
I didn't, and I think because I was trying to grasp the moment, I was trying to get some control, and my whole time I was just trying to get some control, like what's going on. And I just remember the physician, I remember the trauma doc was looking, he was right in my face, and he was like, come on. And then he would turn to somebody, he's like, it's like she's stuck inside there. And I was screaming, I'm stuck inside here. I'm hurting. Somebody help me. What happened? Because I wanted to know what happened and how did I get, miles away from this senior center where I was. I just didn't understand. So, Mark, I was just too confused to even grab a hold of and have any kind of control of what was going on at all.
So what happened then? Did you go to surgery? Did you obviously an inpatient? But
Yeah,
what
so
happened?
they did a series of tests and x-rays and admitted me to the hospital. Later on, I was discharged and, well, listen to this part. I was discharged to home for 30-day rest, 30 days sleep, 24 hours, 30 days sleep, because I was being entered into a Bryn Mawr Rehab Brain Injury Institute outpatient for patients that have traumatic brain injuries. At that time, I was diagnosed with a severe brain injury. I was aphasic, so I was having trouble. I would think of what I would say, and then other things that had nothing to do with it would come out. I had dysphagia really bad, so I was having problems swallowing. I was confused. I had horrible short-term memory loss, and like I said, my speech was awful, just awful. It was awful.
I've had the opportunity over the years. In fact, I believe I keynoted at Bryn Mawr Rehab probably 10 years ago.
Right, I
And
remember.
I've had the opportunity to be at plenty of rehab hospitals around the country, and I know for myself, having suffered a Lafort 3, and just how fortunate I am to have had, if any, very limited cognitive impairment from that trauma. And it's something that I struggle with because I don't know what that's like, but I've been around enough trauma survivors, traumatic brain injury survivors, to know that you're a walking miracle. right now, the fact that you're speaking to me,
Yeah.
you are a walking miracle.
A lot of dedication and work on my part, and all the healthcare workers that help me, and my physicians and my nurses. But you have to have a sense and a will to fight. And even though I was told that my doctors at Bryn Mawr told me straight up, you have a severe brain injury, this is going to be hard. We can't promise you that you'll ever be a nurse again. I was told that early on, and they were pretty blunt about it, and that was all I needed to hear. That's what I was like, I am going to be a nurse, and I'm going to fight through this part. I think the way that I got to you was because I was suffering trying to be the other Cheryl, pre-accident crash Cheryl, trying to laugh like her, act like her, talk like her, and I couldn't do it. And I spent a lot of time trying to be that person that medically, physically, I couldn't be anymore. Cognitively, I couldn't be anymore at that time. And it was extremely frustrating and at times depressing, because I was searching for her and I had nothing to grasp at all.
So did you not, so you didn't feel like yourself? And boy, that gets into some psychology and philosophy, right? What is the self, and how does, is it separate from the spiritual beings that we are, right? And I can only imagine how difficult that had to be, navigating that, still dealing with, as you said, difficulty with speech and concentration, etc.
Right. I mean, I of course I knew I had been a nurse, so I knew I knew how to read and everything. But at this time, Marcus, I had lost my memory how to read and write. I was, and still am, deaf in my left ear. I had these injuries that, not only did I have these injuries, but that's the psychological part of trying to get through it. I can't talk. I can't even communicate correctly. I would want to say, pass the ketchup, and I would say something would come out like, there's an airplane flying over. And trying to communicate to people, even out in public, which I did not do, is embarrassing to me, and because I was such a type A. I had just 6 months prior to that, had just graduated with my bachelor's degree, and had taken care of patients, 4 patients in the trauma room, was running things, and it was in control. And now I can't tie my shoe. Can't tie my shoe. Heartbreaking. So how do you move from how you were to where you are? And so you do try to, the only thing I could do was try to spend time trying to be like her and trying to think of how she did things. But it was such a waste, because I had talked to one of the ministers at my church, and she said, stop. She was like, you need to accept who you are, let her go, and concentrate on bettering who you are right now. And that kind of got me over this lump, because I wasn't even concentrating on what was going on and being present in the moment of what was going on. I was still trying to reach for that unattainable woman that I was, 30 days prior.
What a powerful word, right? And I think what a word for you in that moment. You got to let her go.
Let her go.
But what a word for all of us, right? Let go of who we think we need to be, or who we should be, or who we used to be. Maybe it's as simple as Disney Frozen, let it go. But,
Yeah, right.
but I that speaks so much to me. How did you then take that? How did you then move forward with that?
That was a huge moment in my recovery. Okay, so I let her go, and now I have to go through acceptance of this new normal and my new life. All right, so let me take her in. All right, she's got back pains and neck pain, and she's, sensitive to light, and, everything is so loud. She doesn't speak well. I had to learn how to read again. Read, write, arithmetic, multiplications, percentages, it all. And, thank goodness for, my speech therapist that I had, because those were rough times. Trying to learn how to read again. For me, it was at times embarrassing, because she started off. I had to learn vowels. I don't have any memory of any vowels. My eyes hurt physically. My eyes hurt to look from side to side, and I wore sunglasses inside because it was just too bright everywhere. It's little things like that I had to accept, gather up, and take with me as I healed, and learn how to accept and move on in this new normal and get better and get on with it,
Yeah. And sometimes that's easier said than done.
Absolutely. Because I don't want to be different. I didn't want to be different.
I think there's a part of us all that maybe even goes back to like middle school, when we all want to fit in.
Yes, sir.
Right?
Yes, sir.
There's a part of that in society. And when you know that there is a physical difference between you and the quote unquote average American person in society, right. It's almost like there's an extra sense of overcoming. Right. There's an extra sense of overcoming.
Absolutely.
How did that manifest in you? Because obviously you're still a go-getter. Right, you didn't lose that part of who you are. You went on for a couple of more masters,
yeah.
2 masters, correct?
Right.
So you went on. You fought through that.
Yeah, I fought through because I didn't want to. When I went to speech therapy, I told my therapist, both of them, I don't want to talk. I don't want to speak like this anymore. I don't know what's on your list of priorities today, but I don't want to drool anymore. I don't want to limp anymore. I don't want to, try to, stutter through and try to get through a sentence and can't even remember, the subject of the sentence. Tell me what I have to do to get, I guess, to appear normal.
One of the words that I've talked about with my counselor a lot is competent.
Yeah, right.
Competent.
How about that?
Yeah, I want to not only be competent, I not only want to appear competent,
yes,
but yeah, there's I understand what you're saying.
I wanted to appear competent, and there was nobody that really understood. My parents were there for me, and have been through thick and thin, but they didn't quite understand, and I didn't really understand it myself. And I knew that I needed to push on and get over this, and I did. And about 1.5 years into my recovery, I had started reading and writing. I had started doing PowerPoints with my speech therapist, and I was doing everything they told me to do so I could get better. Maybe not 100%. I wasn't even looking for that. I just wanted to get better and get on the road to getting better. And so I had an appointment, follow up with Bryn Mawr Rehab with my physician. I asked him at that time, could I enter it into the master's program? He said, absolutely not. You're at your 2-year mark. Your brain is still healing. Let's talk about this next year. And I had already applied to grad school already. and I didn't tell him that it was a double master's degree and that I really was going to do it because I learned how to read. And so here's the thing. With my brain injury, it has done the opposite. It actually, my brain doesn't turn off. It actually would love to sit up all night long and write papers and, read books. And so I had to learn how to calm it down. And because it liked these 2, master's degrees, I did both of them online. I graduated in a year and a half, summa with a master's degree in executive nurse leadership, and then a master's degree in management and healthcare administration, and was accepted into several honor societies. One was a business honor society for a lifetime membership due to my scholastic efforts, and
what is the name of that society?
So I'm in Sigma Beta. And it, I'm in another one that is just for people that have disabilities. Mm-hmm. And, I think all of this is about, accepting what I have and using what I have and bettering that and not going backwards, trying to grab and attain things that I did when I was prior to my brain injury. And that's why, I sometimes I'll say, I'm only 9 years old. I've only been reading and writing for 7 years, and every, year that goes by, anniversary goes by, I'm like, I did this, I got through this, but I still have things around me to remind me of my struggles to help keep me humble. When I was healing, and I still am, because I still have, difficulties that I'm working through, but I have, when I was going through the beginning of my healing, I always had a little red book that I always kept with me, and I would write down things. Get up in the morning, put toothpaste on your toothbrush, because I didn't know, when I'd wake up, I didn't know the sequence of things, and to go back and look at, I got the book right here, Marcus, and actually I wrote it and used it, it's from a Nurses Association, and I used to keep this in my pocket. And when someone would tell me something or I would have to write it down because I couldn't, my memory was so bad, I couldn't remember from room to room what to do, And so to go back and read things in that book, I saw one thing in there this morning. I haven't opened that book up in years. It said, cut yourself a break.
Oh, wow.
Cut yourself a break.
Wow.
And I said, I teared up when I read that.
Yeah.
Because I could remember the struggle, and the frustration of not being able to communicate, and just thinking about how am I going to get through this, and what am I going to do now, since I won't be a nurse anymore. What am I going to do? So cut yourself a break. And that's hard. That was hard to see.
Grace is hardest to give to oneself.
Isn't it?
Grace is hardest to give to oneself. And again, what a word for everyone. Right. What a word for everybody. Cut yourself a break.
Cut yourself a break.
But you did. You did. You stayed a nurse, and you cut
Yeah.
yourself a break. Obviously, you're here.
Yeah.
You're, healing every day. So
Yeah.
bring us into the, I guess, the present day.
Man. So, God is good in this world, boy. Really socks it to you. So yes, I was full blown, let's do this. And that's how I am right now. Life is too short. Show me what I need to do. I'm all in. Graduated with those 2 master's degrees, and went on to be assistant director of nursing at a rehab facility, but still wanted to be back in the hospital realm, and saw a opening for an assistant nurse manager position at this level 1 trauma center in Delaware, and was like, I can do that. I can do that. I have 2 master's degrees. I have all this, education behind me. Let's do that. Because by that time, I had, right before my accident, I had been with, the late Attorney General Beau Biden, and had worked with him, along with Lieutenant Governor Bethany Hall Long, to get bath salts a level 1 felony in the state of Delaware. So I had all these things that I had done in the past, and I said, I can go to this level 1 trauma center and lend my resources and my leadership and interview. And I did, and I got the job. But Marcus, let me tell you why I was standing there waiting to go into my interview. I started to have these weird flashbacks. Flashbacks like I had been there before. And after my interview, I called my friend and I asked her, because her mother worked on the same floor that I was admitted as a trauma code after my accident. And that was the floor that I was brought to as an inpatient. And
that's your floor now.
And that's my unit now. I got hired on that floor. Absolutely.
How is that? Tell me about that, like, emotionally.
So going in the room that I was in and remembering where I was laying in that bed, I remember little patches of things, but I remember being in that room. I remember my brain it almost felt like so loose, like I had no control over it. I didn't know what was going on. You could have led me outside in the street and I would have just went with you, because I just had no control. And to be walking around and leading and being co-workers alongside, these wonderful nurses and PCTs and physical therapy and occupational therapy, members of this unit on 2C, to be walking around and watching them do what they do and knowing that you were in that bed. And when this is a unique opportunity, I thought, and still use it to my advantage, when I have, we take care of on that floor, we're orthopedics, we're neurology, we're trauma. And when I have patients on that floor, traumatic brain injury patients, actually, that I see that are struggling, because you do, and you will have bad days. And sometimes it is a calling to me. I share when I think people need to hear it, and when they need that boost that they can do it. Because I always feel like I remember laying in that bed and you have nothing but silence and time. And time and silence can eat you up, And so your thoughts can get away from you. And, I've had some traumatic brain injury patients that have really had struggling days, and I have taken them aside and say, hey, let me tell you something. You can do it. This is what I did. Let me share something with you. And just they love to hear that they can do it and they can get through it. And it's usually after, it's always after they've known me for a couple of weeks. And then I tell them, if I think they need to hear it.
Mm-hmm. Yeah. That's a powerful moment, too, to say, hey, by the way, I laid on this floor as well.
Absolutely.
I dealt with a lot of the confusion that you're dealing with, the same struggles, the loose brain, as you said.
Right.
What a testament to be able to fully empathize with those special patients.
Yeah.
What a beautiful story. What a beautiful story.
Yeah, I love being a nurse, and this love of this profession has been the foundation of my journey, my new normal, Mm-hmm. And I just want to thank you, Marcus, because I reached out to you to help me. And to help me, what do I do now? I can't hear. I'm not speaking very well. I don't walk very well. How do you move on? And that moving on part is how you helped me. That's what helped me, is when you reach out to resources that are available to you. But, when I heard your story, and I have your books, when I got to meet you, you're a rock star to me. And for people like me that have had trauma and can hear your story and can hear how you've overcome adversities and how you can do it, that's what makes you want to do it. I'm like, if Marcus says that I can get through this, and if I concentrate, if I really dig down, I can do it. He's doing it. I can do it. And you really, really helped me at a very pivotal point of my healing.
I'm so glad to have been even just a small part of your process, because the person that you are is awesome.
Thank you. Right back at you.
I did not know you prior to your injury, but I have known you now for nearly a decade, probably. And I just, it's an honor to see you doing so well. It's an honor to be your friend. And thank you for being with me today. Before we go today, I've got a couple of random rapid fire questions.
Hit me. Get me.
All right. So, first question. Let's say you were on a desert island. You're stranded on a desert island, but you get to keep one piece of art with you on this desert island. Be it a piece of visual art, a movie, a book, maybe even a Netflix series.
Right.
What piece of art would you keep?
I think I would. I have a picture of my family, my mom, my dad, my brother, and my niece and myself. And I would keep that and take that with me, because, I can reach back and think about good memories, that would help me get through, the days and the long nights trying to get through that desert. I would take the picture of my close loved one that I have with me. And if it was a double print, I put Coda on the back,
Yes, the dog is the part of the family.
Yeah. But that's what I would do.
That's awesome. I think whenever people say, the dog, she's like part of the family. No, she's not like part of the family.
That's my girl.
She is a sentient being in this family.
Yes, if she was here right now, she'd be all up in here with all her codedness. She'd be
all her codedness. We'll have to get Elliot and Coda together.
Oh my gosh,
to meet and play sometime. Okay, so my second question for you is, if you could live for one day and live the life of any fictional character, who would that person be and why?
Oh, fictional character. I would be, let me see. I would be Wonder Woman. And let me tell you why. Mm-hmm. So she is, she's like the epitome of what, when you think about a woman and this strong sense of a woman and what she can do. And I would be Wonder Woman. I would be Wonder Woman for a day. I get in that jet. I want that invisible, because if I'm going to do it, I want all the stuff. Right, so I want the lasso, I'd make, people tell the truth, because I'm really big with, especially with my employees and with my patients as well, with honesty. I would use my wonder powers, to help cure COVID, to help, our healthcare workers, when they're feeling down, I put them in the jet and I fly them around. I don't know. I use it for good, use it to help, our nurses and our healthcare workers that are struggling right now.
Yeah. Speaking of that, I am sure that your hospital wants nurses just like any other hospital across the country. Right. You want to make a pitch for anybody that wants to come work alongside you?
Yeah, I work at a wonderful top-notch trauma center, Christiana Care. I am at the Newark campus, and I am the assistant nurse manager on 2C, orthopedics, neurology, and trauma. I work with, I know everybody says this, but I work with the best group of people, tight-knit people, because our floor is tough. Our floor is tough, and our patients are sick, and our patients are sick everywhere. But this particular floor, we are all about teamwork, and I have such respect for my coworkers. And, when we talk about COVID, we talk about doing things differently. We have to do things differently, but safely. People that are in my position have now transitioned back to the bedside. And it has been a journey for me these last couple weeks, as I am, 3 out of the 5 days every week, I have become a floor nurse again. Mm-hmm. And it has been a wonderful addition to my daily tasks that I was doing. But to have these nurses, these 20-something nurses, teaching me, how to do things again, has been, something that is different for me, because I've been a nurse 22 years. And so when you get to that point, hey, I know how to hang a, IV bag, and I know how to do this. Hey, back in my day, but things have changed. And so I'm, now I'm leaning on these 20-something years old to help me, get back into it again.
But boy, may we all remain lifetime learners.
Wow, yeah, you have to be. Especially in nursing and healthcare, you have to be.
Constant innovation.
Absolutely.
Yeah, absolutely. All right, so my last question for you is, let's say that you opened up your wallet, your purse, your Bitcoin app.
Yeah, right?
Whatever you have. And you found that $100 had magically appeared in your wallet or your account. What would you spend that $100 on?
I'd take that $100 and I'd spend it and add to it to buy food for my coworkers at work. Those nurses and those healthcare workers, I know it seems minimal, but just to say thank you. Thank you to all the healthcare workers out there and all the nurses, all the physicians, because like I said, these are tough times, and I would take that time and that money to spend on them just to say thank you. Thank you for being you. Thank you for giving back. Thank you for caring.
Yeah. It seems like you said, it kind of minimal or whatever.
Right.
I remember at the beginning of the pandemic, I asked a question. I was like, how can we show appreciation without carbs?
Right.
Right. How can we show appreciation without carbs? And it's something that we that we continue to try to do.
Right.
And today, Cheryl, your story, your experiences, your courage, just being a nurse, I cannot thank you enough for spending time with me today.
And
thank
anytime.
You so much for sharing.
Anytime.
Thank you. And thank you, everyone, for tuning in for this episode of Compassion and Courage, Conversations in Healthcare. Thank you to everyone who is subscribing and rating and reviewing. Thank you for sharing the information on this podcast. We always want to be able to bring stories like Cheryl to you to remind us of our shared experience of humanity and how we can all be more compassionate in this time. Thank you again, Cheryl.
Oh, thank you.
Take care.